Hi, my name's Katrina Keebler. I'm a pharmacy manager at a CVS here in Omaha, Nebraska, and I'm going to be speaking to you today about the pharmacy technician's role in COVID-19 vaccinations. So back in December, CVS got the word from the U.S. government that we would start administering the vaccines to nursing homes. And so we knew that that would be a massive undertaking, and that we needed to get together as much staff as possible to be able to administer these vaccines. And so we were looking into getting our technicians on board, since we have so many technicians available. And the first technicians got their certifications back in December, and we started the clinics at the end of December and into January and February. And I was part of the first wave that went out in January to help with the clinics and the nursing homes. So I worked side by side with technicians giving the vaccines. And then we eventually transitioned to giving the COVID vaccines into our pharmacies. And so actually all of my technicians signed up and took the class, and all of my technicians at this point in time administer the vaccine in our store. So during this presentation, we're going to kind of go through the clinical reasoning why we're getting these pharmacy technicians able to give the COVID-19 vaccine, the steps to take to become a pharmacy immunizer, and then where we can kind of go from here after the COVID-19 pandemic is hopefully over. So there currently are 328 million people living in the United States. Ideally, we would like to reach herd immunity, which is over 70% of the population. So you can see that's a huge population that we need to get vaccinated with this vaccine. We currently have physicians and nurses and pharmacists and pharmacy interns that are able to immunize, but we need more immunizers. And so it made sense for us to get pharmacy technicians on board. Currently, 90% of Americans live within 5 miles of a pharmacy, and so it's a really big access point for people to go to the pharmacy to get the COVID-19 vaccine. And pharmacies are the second highest provider of influenza vaccines, so I think we can kind of translate to easy access for the COVID-19 vaccines. So the President introduced the Public Readiness and Emergency Preparedness Act, which I'm going to refer to as the PrEP Act, and that allowed pharmacists, pharmacy interns, and pharmacy technicians the authorization to administer the COVID-19 vaccine to the public. So that was the legislation that was introduced to allow pharmacy technicians the ability to immunize just this vaccine. It's only COVID-19 vaccines. It's not any other vaccines at this point. And there have been studies that have already shown that technicians were able and successful in administering other vaccines. There was a 2016 vaccine done in Idaho with 25 pharmacy technicians, and they administered almost 1,000 vaccines between December and May, and they had 0 adverse events. And then on the federal level, the Commission Corps of the U.S. Public Health Service announced that credentialed pharmacists have the chance to provide federal pharmacy technicians an opportunity to obtain training to administer vaccine. So there had been some research done to show that pharmacy technicians are successful in administering vaccinations. So I think it was a logical next step in terms of access to get the vaccine to the public. And so the steps to become a certified pharmacy technician immunizer. So the PrEP Act that was introduced, there's 2 main parts to it. The first part is pharmacists, interns, and technicians must be under the supervision of a pharmacist. So there has to be a pharmacist that is supervising the technician. And this can kind of tie in also to your code of ethics. On Part C, a pharmacy technician assists and supports the pharmacist in the safe, efficacious, and cost-effective distribution of health services and health care resources. And then the second part of the PrEP Act, a qualified pharmacy technician must complete a practical training program that's approved by the Accreditation Council for Pharmacy Education. This training program must include hands-on injection technique and the recognition and treatment of emergency reactions to vaccines. So this can kind of also tie into the Code of Ethics on the pharmacy technician's first consideration is to consider the health and safety of the patient and to use knowledge and skills to the best of his or her ability in serving others. So by far the most popular certification course and the one that we used at my job to get the technician certified was the AAPT course. And this is good. This will get you 6 CE hours. There's 2 hours of online self-study, and then there's live seminar for 4 hours. There is the practical demonstration, so you will need someone to sign off that you have done the practical demonstration. I signed off for my technicians. They did practice on each other. They practiced on me. So we didn't let them practice on patients until I signed off. So our thing was it had to be an employee of the company that they practiced on. So I preferred that they practice on me because I could tell them if they weren't doing something right because I was the one that was feeling it. So they did a great job. We have patients that really love them. They come back for them. So I was really happy to get them certified. And then this one, the website does say this does not provide certification, but advanced professional training. But once you're done with that, you can print a certificate of achievement. The cost of this is, if you are a member of the APHA, it's $239 for the class. If you're a non-member, it's $299. However, if you do that, you do get 1 year of membership included with that. Now, what we did at my job is we actually paid them to take this course. So we really wanted to get as many immunizers as possible. So we paid them the time it took them to take the course. We paid them to take a CPR class. So, and then we kind of counted the practical demonstration. That didn't take so long, but they were reimbursed for the time it took to take this class. And we paid for the cost of the class too. And then another thing, this is usually if you are, the PTCB offers a certification for it, but this is only if you're a member of the PTCB. And if you have to have an active CPHT certification, but you also will have had to completed one of the recognized immunization training programs, such as the APHA course. There are some states like Washington and New Mexico and some other ones that do offer their own state-led programs, and those are also recognized. And then this is a really good one if you're trying to achieve the advanced PTCB certification that they do offer, and this is about a $39 course, and that's an online test. And then another one, which I think is what UNMC offers here, is the medication aid certification. That's correct? Okay, so that one is available. That one's available at some pharmacy schools. That's available at community colleges. And that one can kind of vary in cost, sometimes $250, sometimes $350. It just depends if your employer will reimburse you for the cost of these courses. The good thing with this would allow technicians to continue to immunize once the COVID-19 emergency has ended. So currently the other courses don't offer that, but this is the course that if they have a medication aid, that they can continue to offer influenza vaccines and pneumonia vaccines. But that's only if your employer would allow that. So what do these programs look like? You're going to have to learn the vaccination schedules. So for Pfizer, it's 12 and above, and for Moderna and Johnson & Johnson, it's 18 and over. So you'll have to kind of know the appropriate age for the vaccines. Preparation for vaccine administration. So we started with the Johnson & Johnson vaccine, but we switched to the Pfizer vaccine once the authorization for 12 and above was approved. And so my technicians had to get really comfortable with reconstituting the vaccine because we were seeing so many people come in that I couldn't always be there to reconstitute the vaccine, and they had already been trained to do it. So they got really good at reconstituting. The needle length also, so if you're vaccinating a small 12-year-old compared to a large 50-year-old man, are you picking the appropriate needle length? Procedures for subcutaneous and IM injections, and vaccine safety, such as using sharps containers appropriately. correct PPE to use, and vaccine documentation like the vaccine information statement, vaccine receiving, storing, and disposal, just to see if you are, so Pfizer had quite a different vaccine storage, which has luckily now changed where we can refrigerate the vaccine, but when it first started, we had to be really careful with it, putting it in dry ice and making sure that it was transported correctly. And then managing vaccine-related adverse reactions in emergency situations, such as if you would need to use an EpiPen, when to call the ambulance if any adverse reaction would happen. Luckily, we have not experienced any of those. And then, so where do we go from here? Once the COVID vaccine emergency has ended and the pharmacy technicians have put in all of this time and effort to be trained, and then they have been vaccinating for a really long time, are we able to maybe get it so technicians can start giving flu shots and pneumonia shots, and just kind of the future of where that is? So currently 41 states have language that prohibits technicians from administering immunizations. So it's very, very uncommon for a state to allow a technician to immunize right now. And so we need to look at the stakeholders, such as the pharmacy technicians, the pharmacists, the employers involved. They'll have to work with state agencies and boards to propagate this change. I, for one, would really, really like if my technicians would be able to continue to immunize, especially since we're gonna be getting our first shipment of flu shots next week. It would just be much easier if we could. And one of the biggest things that my technicians have really appreciated is that they get a shift differential for immunizing. So they get paid extra money to give vaccines. So they would really, really like to continue to have this happen. So I think that if we can show how successful this has been in the community and in clinic setting about how the pharmacy technicians have helped with that, maybe in the future that can be for all vaccines. Does anyone have any questions?